What are the stages of atrial fibrillation? So remember, atrial fibrillation is defined as abnormal electrical cells, source cells, cells that have the ability to sleep and do nothing or randomly wake up, generate their own electricity, and actually fight for control of and override your normal source of electricity that tells your heart what speed to beat at, because your heart runs on electricity as a big muscle. So if you define AFib or any abnormal heart rhythm as these abnormal source cells that can create electricity and control your heart, and nobody controls them. So atrial fibrillation is a progressive rhythm problem, and it has stages. So we said that aging is one of the primary causes, if not the primary cause, of atrial fibrillation cells forming. And the specific chamber of the heart where atrial fibrillation forms is there's 4 chambers in your heart. There's 2 upper chambers and 2 lower chambers, 2 atria, 2 ventricles. The left upper chamber of the heart, the left atrium, the walls of that chamber are where atrial fibrillation these cells always form. And so you want to think about these different stages, almost like a forest fire. If you say that the atrial fibrillation cells always start on one wall and spread to the other walls, almost like a forest fire that starts in one small part of the forest and spreads to the other ones, you have different stages. You have sort of a small forest fire, a middle forest fire, a late stage forest fire, and then a permanent forest fire. Or if you're thinking about blocked heart arteries, it would be a mild blocked heart artery, 30-40%, a moderate blockage, 50-60%, a severe blockage, 70-90%, or a complete blockage, 100% blocked. Same kind of concept. So the analogy I would like people to use would be that of a forest fire. So if you say, okay, this is not a perfect analogy, but it's a useful one. So think about the left upper chamber of the heart, and that is got 6 walls within it. So you've got a back wall, posterior wall, front wall, anterior wall, roof, floor, and 2 side walls. Now, atrial fibrillation always starts in the back wall. In fact, it starts in the corners of the back walls. There's actually some veins or vessels that are draining blood back to that chamber, and they insert into the corners, and they're called the pulmonary veins. But just know that in the early stages, AFib forms on that back wall, these cells, and they're just kind of in the corners. They're not even covering the entire back wall. And at that stage, it's an early stage, it's like a small forest fire. There's not that many AFib cells. They're not very strong. They don't wake up very much, and they like to sleep. So at that stage, the person's not going in and out of AFib very much. The cells wake up a little bit, go to sleep a lot. They're maybe in it 1%, 3%, 5% of the time. And over 90% of the time, they're under the control of their normal rhythm. But if every year you get older, you could form more atrial fibrillation cells, because it's a progressive problem that gets worse primarily by just getting older. Well, after a few years, you might have enough AFib sources that they're covering most of that back wall. And guess what? They're going to wake up a lot more than if they're just on part of that wall. So instead of it waking up 1%, 3%, 5%, it might be waking up 8%, 10%, 15%, a bit more. Now, you're still mostly not in AFib. You're still 80-90% not in it, but you're definitely in it more. And then when it fills up that first wall, it's going to spread to a second wall, 2 out of the 6 walls. And now you've got twice as many AFib cells, and they're waking up twice as much. So now you're possibly spending 20 to 30% of the time in AFib. Definitely a lot more than 5 or 10% of the time. Then if you have it for enough years and it spreads to 3 out of the 6 walls of that chamber, your AFib could be waking up 50 to 60% of the time. And then if you spread to 4 out of the 6 walls, now your AFib, there's enough cells that it can be waking up 60 to 70% of the time. You're actually in it more than you're not in it. See, the way you want to think about these AFib cells are, if there's a ton of AFib cells on multiple walls of the heart, any part of them awake, you're in AFib. But all of the AFib cells have to be asleep for your normal rhythm to take back over control of your heart and be back in your normal rhythm. And so the more AFib cells you have and the more walls these AFib sources or triggers are on, the easier it is for any part of it to wake up, and the harder it is for all of it to be asleep before you to be completely back in normal rhythm. So you just spend more and more time in it. Now, it keeps on progressing and you spread to 5 out of the 6 walls. That's like a forest fire that's 80-90% of the forest. Guess what? You have enough AFib cells that's waking up 80 to 90% of the time. And you're only out of rhythm, back in normal rhythm, maybe 10% of the time. Now, people always ask, well, does anyone ever live long enough where they spread AFib cells to all 6 walls? And when you cover all 6 walls, will they be in it 100% of the time? Absolutely. Usually it takes 10 to 15 years or so, depending on how quickly you're forming these AFib cells, to reach that point. But when you really do have it on all 6 walls, like a forest fire that's covered the entire forest, you will be in AFib 100% of the time. And that's when we say your AFib is permanent. And at that point, no medication will put the AFib to sleep. No procedure, like an ablation procedure, will be able to get rid of enough from the inside. You just have too much AFib cells. It's like a forest fire that's covered the entire forest. When it's covering every inch of the forest, that's when we say we can't put it out anymore. It's just too chronic, it's just too permanent. And at that point, we say, look, the AFib isn't gonna kill you. As long as you don't have a clot and a stroke, you're gonna live just as long as everybody else. But at that point, we cannot get you out of it. The best we can do is just slow it down and try to make it so that you can tolerate it or don't feel it. So there's these different stages. Now, officially, the classification is paroxysmal atrial fibrillation, persistent atrial fibrillation, long-standing persistent atrial fibrillation, and permanent atrial fibrillation. So this is just us putting sort of markers on this, what's really a continuum of disease or a continuum of the forest fire. It's not like early, mid, late, permanent. It's kind of small forest fire, medium forest fire, large forest fire, permanent forest fire. It's the same kind of thing. So we define paroxysmal atrial fibrillation, which means episodic, paroxysmal atrial fibrillation, as being somebody whose AFib is waking up and going to sleep, but the episodes don't stay awake for longer than 7 days, 1 week. So if you're having episodes less than 7 days, we say you're at an earlier stage, you're a paroxysmal atrial fibrillation. If your episodes are waking up for longer than 1 week at a time, longer than 7 days, we say that you're persistent atrial fibrillation, which correlates more to a mid to later stage. If you are persistent atrial fibrillation, where your episodes are longer than 7 days at a time, and you've been like that for more than a year, so now you're probably spending 70, 80, 90% of the time in it, you're in it most of the time, that would be classified as long-standing persistent atrial fibrillation. It's a really big forest fire. And then of course, when you cover all 6 walls and you're in it 100% of the time and you don't spend any time back in normal rhythm, that's when we say your atrial fibrillation is permanent and we cannot get you out of it. Now, once again, these are sort of arbitrary classifications. They're no different than saying a small forest fire, a medium forest fire, a large forest fire, and a permanent forest fire. But clearly there's, it's a continuum of disease, a continuum process. Could you have a small forest fire that's closer to being a medium-sized forest fire, or a medium-sized forest fire that's closer to being a large-sized forest fire? Who's to say that you spend 6 days in AFib at a time, that the number of AFib sources or triggers isn't more like what we would see in somebody who's in the next stage, persistent? So you can't necessarily just say, okay, paroxysmal means you only have a few AFib sources and then the later stage you have a whole lot more. It's really more of a continuum of disease, which has more to do with when we do an ablation from the inside to try to get rid of these cells. That has more to do with the techniques that different people use, and there are a variety of techniques that people use, and not everybody does the same thing in terms of trying to get rid of it and how effective they are in terms of whether somebody's what stage they're at, when it really is actually more of a continuum of disease. And these are just kind of arbitrary classifications that we put just to denote early, mid, late, permanent. But those are the official stages of atrial fibrillation. And you can see how it's important, because if you wanted us to treat your symptoms by getting you out of the atrial fibrillation, if you wanted to use a drug to keep the AFib asleep, well, what stage of AFib you're at and how many AFib cells you have and how many walls we think are filled with these AFib sources or triggers, it's going to determine how strong of a medicine we're going to want to use or need to use to keep you asleep. Or if we're going to do an ablation, how complex of an ablation we need to do to even have a chance of getting rid of the AFib cells, because some people don't do complex ablations, and therefore if you have a more advanced stage of AFib and you're going to have an ablation, you want to make sure you go to somebody who can do more complex ablations and not somebody who's just doing a little bit. If you had 4 walls worth of AFib and you're in it 70% of the time and they only get rid of 1 wall, well, they're not going to really get you a good result. So this is where the staging of atrial fibrillation has its most impact, is trying to get the person back to normal rhythm, either with a medication or a procedure, and how difficult that might be.